Hello everyone, my name is Jeremy Steger. I'm here with Aspen University with my assignment on the lungs. So first thing what I did is I created a lung representation here. So we have the lungs that will inflate and deflate on the diaphragm, which is represented down here. So when we pull on the lungs inflate, causing them to have a negative pressure in this vessel, which is the thorax. So then when we push the diaphragm up, which is breathing out and pushing out as much air as we can, you can see the lungs deflate as much as possible, and that's exhaling. And then we have a normal resting, which is just plump but not inhaled or flattened. We also have the lungs size. So for instance, I have a smaller bottle. Other students are doing large 2-liter bottles. I'm doing a 100 ml bottle here. So this can represent a child or someone with compromised lungs that has COPD or anything like that. That can also affect your lung capacity along with exercise. I found a good article from Mary Carey. She goes in depth on how well it can be to exercise and to make sure that you're using your lungs to the fullest, using a kinesthetic and respiratory muscle function. So a good tool for that is an incentive spirometer that will strengthen the lungs to the point where you can breathe in and have that full exhale and then breathe out fully with that exhale. Next we have how asthma affects the lungs. Asthma is a fairly simple disease. Basically, anyone can develop it. It can be triggered by multiple different things, such as pollen, any kind of allergy to food, anything like that. So it's basically the closing of the airways. Although with asthma, this is a chronic thing that people deal with often because pollen is so prevalent in our society right now. You have trees, flowers, everything, so that can cause a restriction in the airflow. Basically, it will be the restriction in your bronchioles here, and so if you cut off air, it's harder for your lungs to inflate, causing a restriction in the lungs and inability to get enough oxygen into the bloodstream. Asthma basically can have attacks, or it could be a mild version, it can be all kinds of stuff. But as a nurse, we would want to make sure that we're aware on this, especially with the kiddos. They have a lot smaller lungs, and it's harder for them to breathe with a constricted lungs. So we would want to make sure that we're attentive during our intake and even during the stay of that patient, because they could become allergic to anything or have an attack due to a short-acting medication that they probably already have. This being albuterol. That's another good one that's typically short-acting as long as the patient has it. Sometimes they have long-term stuff such as salmeterol, which is a good long-term acting medication for people with chronic asthma. However, a lot of the patients you would usually see have just rescue stuff, such as rescue inhaler that has albuterol in it with a short-acting agent. Let's see. We would want to make sure that we monitor patients' oxygen level, as this can be majorly affected. We also want to make sure that once they are treated with that dilation medication to make their airway normal again, we want to make sure that we educate them on oxygen saturation and when to use the inhaler, because it does take a few minutes to take hold. Let's see. And then with that, we also want to make sure that our patients understand what causes cause them to have the asthma attack. So we would have them retrack their day. For kids, we would have them retrack where they were, if they were playing in dirt, if they were playing through plants, what they were doing that day to see and identify specific things that may have caused that asthma attack. And as a nurse, a quick, easy way to determine this is a patient is obviously in respiratory distress. When we do osculate the lungs, we want to make sure we hear wheezing. Sometimes it can be with a little bit of rhonchi, but it's basically going to sound like a very tight whistle, inhaling and exhaling, because the patient just can't get anything in or out. And with this, the treatment, we want to make sure that that wheezing reduces. We want to make sure that we elevate the bed, make sure that they can breathe properly on their own. And we can even use supplemental oxygen if we get an order from the doctor. I also found a couple good references for support system on clients with asthma, such as the Asthma Athletics. It's a good one that will get people involved in different ways to strengthen their lungs without having just breathing exercises and incentive spirometer use. We also have a Banner Children's Asthma Support Group, which takes them roller skating to the zoo, do jump zones, just any activity that will get their lungs working at full capacity in a safe environment. This will help strengthen their lungs and make sure that they can reduce how they are affected with asthma when they do have an attack, so that their lungs are strong enough to push through that vasoconstriction. But besides that, I'll have my reference list linked down below. Y'all enjoy.